Hi, I'm Dr. Margreet Barnard, your host of the Birth and Baby Show, brought to you by Sister Lillian Center and Sensitive Midwifery. We empower moms, midwives, and birth workers to have the best birthing and parenting experience through natural, physiological, and intuitive care, resulting in birth and baby advice you can trust. This episode is proudly sponsored by Curaden. Curaden aims to create 1 billion healthy mouths because a healthy mouth equals a healthy body and mind. Curaprox Baby gets your child on the right path by starting healthy oral care habits for life. Our products are designed by specialist dentists. The Curaprox Soother supports the normal development of gums, teeth, palate and jaw, and also ensures optimal nasal breathing. The Curaprox Teething Ring with integrated training toothbrush helps your child prepare for the day they start brushing their teeth. Curaprox Baby Teething Ring also promotes the development of sensory and motor skills. The Curaprox Baby Toothbrush gives the gentlest care to your child's precious teeth. The toothbrush makes cleaning teeth fun and joyful. A quick note to the adults about your oral care. It's crucial to balance your oral microbiome. It prevents oral disease and reduces bacteria from entering the bloodstream, thus may prevent heart attacks and strokes. Join the movement. Let's create 1 billion healthy mouths, which will result in 1 billion healthy bodies and minds, making oral health contagious. Visit www.curaprox.co.za. Hey listeners and watchers, thank you for tuning in again for yet another episode on the Birth and Baby Advice You Can Trust show. And for today, I can't be more excited because it's a very special guest. She's my dear sister, yes, my younger sister, and she recently has become a mom. And we're going to be talking everything about that, about the process, the journey, trusting the journey, and also on preparation. So we're going to hear her story on how she embarked on the journey of pregnancy and birth and motherhood. And she actually had a beautiful home birth, and I'm so proud of her. So Ellen, thanks for coming and talking to me.
It's a pleasure, always.
Yes. So tell the audience a little bit more about you.
Well, which side must I look?
You can look at me.
Oh, okay. Sorry about it. I'm a bit confused.
Don't worry.
Okay. Okay. Sorry. I really... Can I just go? Must we stop?
Yeah.
Or we just keep going? Okay.
Let's carry on.
Okay. So, yes, I'm Ellen. I'm 34 years old and I just recently gave birth to a beautiful son. And I really loved walking through the process of being pregnant and giving birth. And so far so good.
Awesome.
Yes.
And you're married.
I'm married, yes, with Matthijs.
Yeah. He didn't want to come in and talk. He said, no, you guys talk, right?
He's looking after Joshua, our son.
That's right.
Yes.
Needs to be done. No,
yes.
he was so much part of the whole process, hey? So, Elle, from the moment you became pregnant, what happened in terms of preparation for you? How did that work for you?
That's a good question. I think it even started before falling pregnant. A lot of people might not think about it, but you actually can think of preparing yourself for falling pregnant. In our case, we didn't fall pregnant straight away. So I was like looking like, why is this not happening and so on. And I didn't want to go the medical route straight away. Then I actually figured out that the way I was eating, which I thought was what was healthy, I was actually starving out my body and my body was in stress mode all the time. So I started making changes to feed my body well so that it's not in stress mode anymore. And I took some supplements, specific ones. And after a while, I felt even my body was more relaxed. And after a while, we felt pregnant. So there started my preparation already.
Wow, I think that can be a whole podcast on its own.
I think so.
We might do take 2 because there's many women, I think, in the same boat.
Yes.
Yeah, but nutrition is so key.
Yes.
And pre-conception health.
Yes.
Yes, that's where it all started, your preparation.
Yes.
So you were already in a good headspace and very conscious on
Yes.
health and making the right decisions
Yes.
before you fell pregnant.
Yeah.
All right. And then
Yes.
pregnancy happened. Yay.
Yeah, pregnancy happened. We were very happy, you can imagine.
Yes.
Then my first trimester, I of course had all the issues of being pregnant, which was nauseousness, and I had to throw up quite a lot. So then I was trying to eat healthy, but then if everything comes out again, you were like, oh, am I actually eating enough? And I couldn't take my supplements at that time because I just couldn't swallow them because of the symptoms. So I was like, okay, well, I'm pregnant now. I still want to nourish my body to give best to baby, but I can't at the very moment. So I had to let go of that a little bit and just trust, like, okay, I did everything I could. Yes, good. And I'm still doing everything I can. So let's trust that this first trimester is just going to be fine for baby and myself.
And it normally is.
It normally is. Yes.
Yeah.
Yeah.
So you had all the symptoms, as much as you had your nutrition state all perfect.
Yes.
And was very knowledgeable.
Yes, they were all
pregnancy
there.
hit you still.
Totally. And it wasn't even till the point of 12 weeks. It was a little bit longer. I think even up till 16 weeks. So I thought like 12 is the edge. Like then you start going to feel better. But I wasn't. It took another 4 weeks. So yeah.
Yes, and it's good to know that can be really, it's still normal. And you had to just go with that, right?
Yes.
Because you talk about trusting the process. So that probably started there already.
Yes.
Right.
Yes. Because in my mind, like a lot of people told me, it's 12 weeks and then you start to feel better. So it was really something I was looking for. But then it took longer. So I was like, oh no, it's going to be one of those ladies that's going to stay nauseous for the rest of the pregnancy. And I was like, eesh, not sure if I am going to like that. But then, just stay positive and do what you can. And it disappeared.
Right. And baby kept growing.
Absolutely.
Yes.
Absolutely. Yes.
And then how does it happen in your mind, the whole thing of preparation for birth, and when did you start thinking about that?
Yeah, good question. I really wanted a natural birth because, well, I've been reading a lot and making the sums up. I think that for me it would have been the most ideal outcome if it would be a natural birth. So I set my mind on it, actually. So that's why I chose to work together with a midwife first at all, that does do home births even. So that was one of the decisions I made to find a midwife. That was the first start, I think. And then I had my first appointment with her and we spoke about everything, like what can happen and how are we going to navigate on the natural birth, but what if things are not ideal enough that you might go into a hospital. So I just got the whole picture clear for myself. But in my mind, I was like, okay, I'm going for this natural birth. And if something is wrong, then I'm going to think about what's going to be next. But my mind is focused. That was very important for me because these days there's so much information. And I think if you don't have a made up mind, it's easy to get distracted by all the different kind of informations, opinions.
Right.
So I think it's easy to get fearful. Which I didn't want to be.
Yeah, that's a very wise thing and a very real thing, I think, for most mothers. I think everyone have to face that whole fear thing.
Yes.
The fear demon. Yes.
Yeah.
So you did that by focusing.
Yes.
And not listening to too many other stories or... Yeah.
And again, that was where for me the very trusting the process factor was again, because I was like, if my body knows what to do from beginning of pregnancy up till the point of birth, why should I start thinking that my body doesn't know what to do anymore once it has to give birth? Because I didn't do anything to grow this little being from nothing to a big baby. My body knows what to do, knew what to do. So that really gave me confidence, actually. I was like, okay, it has done this miracle so far. So probably know how to finish the miracle.
Exactly.
Yes.
That is what I always try to say.
Okay.
Yes. That is exactly it. Yes. And you have to trust that your body knows, and it does.
He does.
Because now you can talk back.
Yes.
What happened?
What happened? Well, the waiting time came.
Oh, yes. Also a good point.
Yes. So you reach the point of 40 weeks and your body starts to feel like, okay, this baby can come now. But then it took another 9 days for me.
Wow.
And because it was my first birth, you don't know exactly what to expect. I mean, you can read 1,000 books, but you don't know how contraction feels. So I had a few days that I felt some kind of things happening. I was like, oh, is this going to be the start or not? And then it faded away. So there was a real waiting part. And then, 9 days after my due date, I had another feeding in my in my tummy, and I was like, no, I'm not going to think this might be the start, because it probably will fade away again. But then actually it was the start. So I started to feel more pains in my back. They were different than the ones I felt before. And then I phoned my sister.
Yes.
And I was like, yo, what do you think? Can you just come and see? So then you told me, maybe call your midwife, because this might be serious. So at first I was like, nah, I don't need a midwife yet. It's okay. I'll. But I think only like 30 minutes later, I sent my midwife a text, you must really come now, because the contractions were coming like wave after wave after wave after wave.
Yeah, amazing.
Yeah.
Yeah, so Elle, let's talk a little bit about the waiting game, because that is a very tricky one. And you really encountered, I think, the pressure of what independent midwives feel in our setting, and especially in South Africa, right? With going past your due date, and you really had to overcome, again, a bit of a fear battle. And how did you navigate through that?
Good question. Trying to think back about of those days. I wasn't really scared, because I think in my family line, like other sisters, they easily overdue. They woke up till 42 weeks. I've been working on the maternity unit in the Netherlands, and there ladies came in 42 weeks, even plus 2 days. So I wasn't very worried about being overdue, because I've seen a lot of examples that just woke up to 42 weeks. So I was like, okay, I don't mind, because I know it still can all go well. It was just all the questions from loved ones around me.
Right.
Checking in, is the baby there? Anything happening? And it comes from a good heart. But that one was a bit tricky for me, because it doesn't help. Because if I get 10 questions a day, is the baby there yet? I'm like, no, it's there, not yet. And I'm also still waiting.
Yes, it's tough for you too.
Exactly, yes. So I find that a little bit difficult at the end. And then, it was a bit of a mind game still to trust that it was going to come before actually the doctor wanted to induce me. Because she was not going to let me walk up till 42 weeks, because in this... her rules are not like that. So actually 41 plus 3, she wanted to induce me. So that made me nervous.
Yes.
Yeah.
So it just happened on time.
On time. On time. Just the evening before I actually probably was gonna send into hospital. It all came.
Wow.
Yes.
Yeah, no, you definitely trusted the process.
Yes.
And it happened. And that it always comes in still with a surprise. Hey?
Yeah.
So do you want to tell a bit about your birth experience? How the birth went?
Yes, that's fine. Contractions came, and then as soon as we actually found out like this might be the real deal, I think I went into labor quite fast. And then it was the one contraction after the other, which was quite a new thing for me, because I've seen other ladies giving birth, and what I knew about birth was you get a contraction, and then you have a little bit of a pulse, and then you get ready for the next contraction. But in my case, there was no pulse. And I kept waiting for the pulse until I started telling myself, there's never going to come a pulse for me. And that was a bit intense, I might say. Yes. Yeah. It was really, and then for me also, I pictured in my mind, I bought this, what is it, gym ball. And I was picturing myself sitting on the gym ball, having my contractions, and that's the way how I thought I was going to do it. But then having my contractions, I couldn't really sit down or lay down. It was just too painful because the contractions were in my back. So I had to stand for like 7 hours on my feet, catching all those non-stop contractions. So it was a bit of a wild birthing part, I think. But I did it.
You did it.
And I think at one stage, I was like, how long am I still able to do this? We never really checked how far I was like dilated, yes. So I was like, maybe I must check, maybe not. And then I thought, if I'm going to hear I'm only at 4 centimeters now, I'm going to get crazy. So I was like, just look forward. There will come an end of this whole contraction storm. And then I think it was only 1 hour later or so. And then the next stage of birth came and I was able to push baby out. So,
yeah, amazing. And that didn't last that long then?
No, that was very quick, I think.
Yeah, because that can, for a first baby, also take long. But it's, I think, because you were so active and mobile and you've been used to that intensity, you just listened very well to your body and went with that.
Yes. Yeah. And when I look back, I'm so grateful that I could do a home birth, because normally in hospital, you have to lay down in your bed. And me thinking back of I couldn't sit or lay down, I probably would have needed like pain medication, or I don't know how I was going to manage laying in a bed in a hospital.
Yes.
So I was like, sure, I'm so grateful that the opportunity was there to do a home birth.
Yeah.
Yeah.
So just for the knowledge, Ellen gave birth standing, which is a very normal, good possibility. Also birth positions. Yeah, I do lots of teaching on birthing positions, and standing is definitely one of them. The best position is the one that feels best for you. Right, so then you had this most amazing boy in your arms, and that was that.
That was that.
And then your life changed forever.
Yes.
How's motherhood?
It's good.
Yeah.
It's I really love it. It's kind of normal as well. I think it comes quite naturally to me. It's probably because I've had a lot of examples around me. I think that helps.
Yes.
So yeah, I'm loving it. And it's a big adjustment because it literally takes all your time.
Yeah.
But it's worth it.
Right.
Yeah.
So any tips that you would love to give to moms to be?
Moms to be, yeah.
Or moms.
Come again?
Or moms.
Or moms.
Yeah, because you are a mom.
Yes. Well, definitely trusting your process, and once you're pregnant, or even if you want to get pregnant, but that's a bit of another story. Your mind can go anywhere, especially if you're going to read everything, and especially if you have all good advisors around you, which comes probably from a good heart, but really stick to your own belief almost, I think, what feels good for you, because at the end you have to be the one that's going to do it. So if you're not confident with the thing you're doing, that's a setup for failure, I think. So you must be confident with whatever choices you make, and I think then you set yourself up for success. Yeah,
that's good advice.
Yeah.
And one last word on your postnatal period.
Take it easy and slow, I think, and also stay close to yourself. I mean, there might be a lot of people wanting to see the baby, and well, for me in the first 2 weeks, I didn't really felt like having a lot of people in my house. I was just so in my zone.
Yes.
And probably that's also nature that does it. I don't know. But maybe be prepared for that as well. That it's okay if people wait for another 2 weeks to see the baby, because it's still going to be a cute baby.
Yes.
And make some meals. Make sure you have some meals in your freezer, because those first 4 weeks maybe you really don't do anything else. Oh, I didn't do anything else than just be with baby.
Yeah.
And it can be a bit overwhelming, I think, if you don't know it can be like that.
Yes, exactly. So it's very important to know, to be prepared in your mind for that period, especially.
Yes.
Because sometimes you can focus on getting the baby out so much, but the postnatal stage is a very another trimester. We were talking about that.
Yes, some people they call it the 4th trimester, which is even up to 2.5 months after birth, which I did experience, because after 2.5 months, 3 months, I felt like, oh, I can go to meetings. I feel like I can go easier out of the house again. Yes. So to me, it felt a bubble kind of stopped a bit at that stage. So it's not just 1 week after birth or 2 weeks. For me, it was a whole other 2.5 months being in a bubble.
Yes. Yeah. That is natural, because your baby really just needs you.
Yes. Yeah. It also didn't feel safe to hand my baby at all other people's hands, or to put him in the car all the time and drive everywhere. It for me, it didn't feel safe for the baby. And now I can see he's a bit bigger. He's actually handling it well when we go out or when he's sitting with other people. So,
So it's good to know that time will pass, because for some women it might be hard.
Yes.
Because they feel like they're missing out on life or what. You naturally surrendered to that process. You quite enjoyed it. So just go with that, I would say. Just and know that the time will pass. Yes. And the little baby stage goes so quickly.
Yes. What helped me a lot was that other mothers told me, like, Ellen, it's a matter of months.
Yes.
So if you compare a month in a lifetime, it's not much. So that really helped me to embrace it. Like, okay, it's a matter of months, which is not much.
It's not much, right? Yes. Oh, thanks so much for sharing your story and your journey and trusting the process.
Yes.
And that never ends, I'm sure.
Probably not.
Being a parent.
Yes.
Yeah, all the best with that. We love Josh so much. And
thank you.
Also well done to your hubby. He was an absolute rock and a pillar in all of this.
And still is.
Yes. Yeah, it's teamwork, hey?
Yes.
Yeah.
It is.
Okay, so I hope you enjoy that. If you have any questions, I'm sure Ellen would be happy to answer them. She is also a nurse and I would say the biggest resourceful health guru. So she's happy to help. And if you have any specific questions on her journey, you can reach out to her. Thanks so much, Elle.
It's a pleasure. Thank you for having me.
Cool. Bye.
Bye.
Thank you so much for joining us today. If you enjoyed this video, please share this with a friend who will benefit from this. And remember to subscribe and hit the bell icon so that you can be notified whenever we release new videos like this on our channel. We'd love to stay in touch and keep you updated with all our latest content and resources to equip and empower you. So if you're a midwife or any type of birth and baby worker, go to sensitivemidwifery.co.za/free gift. If you're a mom, visit sisterlillian.co.za/free gift for more training and resources. That way we can keep you up to date when we release new episodes like this, plus a few other bonuses. You can also find the links I just mentioned in the show notes. Remember, you're making a big difference because you are shaping the future of humankind. Thanks for watching, and I look forward to journeying with you.